Hello guys, welcome back to Clinically Clear. Last video, it got abruptly stopped. Apologies for that. There was a technical inconvenience. I will be continuing with the anatomy of the internal nose. We were at the middle turbinate. As I said, there are three bony projections from the lateral wall of the nose known as turbinates. Out of these, you have the inferior turbinate, middle turbinate, and the superior turbinate, rarely a fourth supreme turbinate. And beneath these turbinates, you have spaces known as meatesis. First, let's look at the middle turbinate. The middle turbinate is derived from the ethmoid bone, and it is an S-shaped bone. It is a very unique bone. Understood? Very unique bony projection. Now, this diagram is very, very important. Here you have the middle turbinate as well as the osteomeatal complex. So as you can see, this is from the top view of the head. When you take a top view and a transverse section, top view, you can see that the medially you have the nasal septum, you have the lateral nasal valve. Understood? Now front you have the anteriorly, and behind you have the posteriorly. Now, the middle turbinate has three parts: the anterior 1/3, the middle 1/3, the anterior 1/3, the middle 1/3, and the posterior 1/3. Now, first let's look at the anterior 1/3. The anterior 1/3 lies in the sagittal plane. That is, it lies in this plane. It is attached on top to the cribriform plate. It lies in the sagittal plane. As you can see here, it is just, when you take a transverse section, it just appears like a sheet because it lies in the sagittal plane. It is attached on top to the cribriform plate, whereas the middle third lies in the coronal plane. As you can see the thickness over here. It lies in the coronal plane. It is attached laterally to the lamina papyracea. It lies in the coronal plane. It is attached laterally to the lamina papyracea. This green thing that I put here, that is the lamina papyracea. What is the lamina papyracea? It is the medial wall of the orbit. See, here you have the nasal cavity, here you have the orbit. So the medial wall of the orbit will form the lateral part of the nasal cavity, right? So you have the lamina papyracea, that is a thin bony plate which forms the medial wall of the orbit. Now, the middle 1/3 of this middle turbinate is in the coronal plane because it goes to the side and it attaches to the lamina papyracea. This middle 1/3, very, very important, is also known as ground lamellae or basal lamellae. Why is that? Because it divides the sinuses into anterior draining sinuses and posterior group of sinuses. The anterior group of sinuses are those sinuses that includes anterior ethmoidal sinuses, maxillary sinus, and frontal sinus, whereas the posterior group of the sinuses includes posterior ethmoidal sinus and sphenoidal sinus. So the middle 1/3 forms the ground lamellae. Posterior 1/3 also lies in the coronal plane and it is attached to the lamina papyracea once again. So anterior 1/3, middle 1/3, and posterior 1/3. The anterior 1/3 is in the sagittal plane. It is attached to the cribriform plate, whereas the middle 1/3 lies in the coronal plane. It is attached to the lamina papyracea. The posterior 1/3 is in the coronal plane. It is also attached to lamina papyracea, but the middle 1/3, also known as the ground lamellae or the basal lamellae, divides the sinuses into anterior group and posterior group of sinuses. Now, one more very important concept, that is the osteomeatal complex. Now, what are all the structures in the osteomeatal complex? This is a bit tricky. Same diagram once again, same view. This is the middle turbinate. As you can see here, I have labeled here, this is the middle turbinate. Let me just change the color. Okay, this is the middle turbinate. Now, you have a hook-like process, this red process here, a hook-like process known as uncinate process. This uncinate process, it runs from the antero-superior direction to the posterior-inferior direction. So if you're imagining, it runs from the antero-superior direction to the posterior-inferior direction. It has three attachments. Okay, see, here what you're seeing, this attachment here, this blue thing, that is the Antero-inferior attachment. It is attached to the lateral wall of the nasal cavity. Understood? Then you have come to this diagram. You have the posterior-inferior attachment. That is the inferior meatus. Now this view is different. This view is when you're looking from the front. When you're looking from the front and you take a coronal section. When you're looking from the front and you take a coronal section, this is what you're seeing. So when you're looking from the front, you have superior, inferior, medial, lateral. You have the maxillary sinus in the cheek opening into the nasal cavity. Then down you have the inferior turbinate. So posterior-inferiorly it is attached to the inferior turbinate. Posterior-inferiorly the uncinate process is attached to the inferior turbinate, and antero-inferiorly it is attached to the lateral wall of the nasal cavity. This is the lateral wall of the nasal cavity, this is the septum, right? Then most important thing is the antero-superior attachment, or just the upper attachment. The upper attachment of the uncinate process. This is variable in nature. There are three main upper attachments. 85% most commonly from the inferior turbinate, that is the posterior-inferior attachment, and the anterior-inferior attachment, as I said, is a lateral wall of the nasal cavity. It goes and attaches to the lamina papyracea. This is also the front view. Do you get it? This is the front view. It goes, and this is the orbit where you have your eye. You have your other eye here. So it goes and attaches to the lamina papyracea, or the medial wall of the orbit, in majority of the cases. But rarely it can get attached to the base of the skull and also to the middle turbinate. So rarely it can get attached to the base of the skull and to the middle turbinate. These are the upper attachments, variability in the attachments, but most commonly the uncinate process goes and gets attached to the lamina papyracea. This is just one component. Then other components, you have an anterior ethmoidal air cell known as bulla ethmoidalis. This is an anterior ethmoidal air cell, bulla ethmoidalis. It is a pneumatized air cell, meaning it is an air cell basically. It is an anterior ethmoidal air cell known as bulla ethmoidalis. Now, this bulla ethmoidalis and uncinate process together, they form the boundaries of the infundibulum. The infundibulum is a space anteriorly bound by the uncinate process, laterally by the lateral wall of the nasal cavity, posteriorly by the anterior border of bulla ethmoidalis. Then this infundibulum communicates with the middle meatus. This whole space is the middle meatus, right? Basically, the part underneath the middle turbinate is a middle meatus, but it runs upward as well. So that space, middle meatus, it communicates with this infundibulum through this pink gap that I've drawn, that is hiatus semilunaris inferioris. It is a groove that leads the middle meatus into the infundibulum. So this is one more component. Infundibulum done, hiatus semilunaris inferioris done, uncinate process done, bulla ethmoidalis done. Now, behind the bulla, see here you can see behind the bulla, posterior to the bulla, you have the retrobullar recess. Understood? Posterior to the bulla ethmoidalis. And similarly, above the bulla, you have the suprabullar recess. Now, this suprabullar recess and the retrobullar recess together make up what is called as the lateral sinus of Grunwald. So the lateral sinus of Grunwald, this, if I'll just change the color to make it less confusing. Let me just take green. So this green part that I'm shading behind the bulla ethmoidalis, this is the bulla ethmoidalis. Behind the bulla ethmoidalis, that is the retrobullar recess. Similarly, you have another one above the bulla ethmoidalis known as suprabullar recess. Together they make the lateral sinus of Grunwald. Now, this lateral sinus of Grunwald communicates with the middle meatus through this green circle. This is known as hiatus semilunaris superioris. Understood? This is one more thing. So, what are all the components of the osteomeatal complex? The uncinate process, the infundibulum, the hiatus semilunaris superioris, the middle meatus, the middle turbinate, the bulla ethmoidalis, the hiatus semilunaris inferioris, superioris and inferioris, the retrobullar recess and the suprabullar recess together making the lateral sinus of Grunwald. Remember the attachments of the uncinate process. It runs antero-superiorly to posterior-inferiorly, but it has three attachments: antero-inferiorly to the lateral wall, posterior-inferiorly to the inferior turbinate, and superiorly to the 85% of the cases to the lamina papyracea, and otherwise to the base of the skull or to the middle turbinate. Now, let's look at another point known as agar nasi. What is agar nasi? Agar nasi is the anterior-most anterior ethmoidal air cell. What is it? The anterior-most anterior ethmoidal air cell is agar nasi. Okay. This is about the osteomeatal complexes. Now let's look at all the structures opening into the lateral wall of the nose. So what are all the structures opening into the lateral wall of the nose? Let's go from superior to inferior. Now this is the lateral wall. So we're looking at it from the side view. Superior most, medial to the superior turbinate, not in the superior meatus, but medial to the superior turbinate, you have the sphenoethmoidal recess. You have the sphenoethmoidal recess. So if I take it here, this is the sphenoethmoidal recess. What is it? It is the opening of the sphenoidal sinus. Then in the superior meatus, below the superior turbinate, you have the opening of the posterior ethmoidal air sinus. Then in the middle meatus, as I told, you have the anterior most frontal sinus, then you have the anterior ethmoidal sinus, and you have the maxillary sinus. This is in the middle meatus. What all divides this? This anterior group of sinuses and posterior group of sinuses is divided by the ground lamellae, as I told, or the basal lamellae. Then in the inferior meatus, the anterior part of the inferior meatus, you have the opening of the nasolacrimal duct. This nasolacrimal duct is guarded by a Hausner's valve or a Hasner's valve, whatever you would like to call it. I don't know how to pronounce it. So basically anteriorly you have the nasolacrimal duct. So, and remember, this opening of pharyngotympanic tube or the eustachian tube, it is not in the lateral wall of the nose. It is in the nasopharynx, lateral wall of the nasopharynx. But we're mentioning here in the diagram to make it easy to find out what are all the structures opening in the lateral wall. So you have medial to the superior meatus, sphenoethmoidal recess, sphenoid sinus. Then in the superior meatus, posterior ethmoidal sinus. Then in the middle meatus, you have the frontal sinus, the anterior ethmoidal sinus, and the maxillary sinus. In the inferior meatus, anteriorly, you have the opening of the nasolacrimal duct. Then coming to the blood supply. See, blood supply also, you have similar to the nasal septal blood supply, you have the branches of the internal carotid artery, ophthalmic artery, giving rise to anterior ethmoidal artery, posterior ethmoidal artery. Same as that. There also, to the vestibular area, you had branches of the septal branch of the superior labial artery, which is a branch of the facial artery. So here also you have branches of the facial artery. Facial artery is a branch of external carotid artery. Similarly, you have greater palatine artery, lesser palatine artery, branches of maxillary artery. Branches of maxillary artery, you also have the sphenopalatine artery, which gives rise to its branches. So maxillary artery. So you, from the top, you have branches of internal carotid artery, giving rise to ophthalmic artery, then giving rise to anterior ethmoidal, posterior ethmoidal. Then from below you have anteriorly you have the branches of the facial artery, and you have greater palatine, lesser palatine, and branches of sphenopalatine artery, all which are branches of maxillary artery. So all of that from external carotid artery. So very, very similar to nasal septum. Then coming to the lining membrane. This is a fairly simple topic. So basically, the vestibule, I told you the vestibule is lined by the skin. The vestibule is lined by the skin. Skin, vibrissae, that is the short, stiff, curved hair, sweat glands, oil glands, etc. So you can have furuncles there. You can have folliculitis. You can have furuncles. You can have sebaceous cysts, various different things. Then come to the olfactory region, that is the vestibular region. Then in the nasal mucosa, nasal cavity proper, you have two regions. You have olfactory region and you have respiratory region. Olfactory region is by olfactory epithelium. Olfactory epithelium helps in sensation of smell. So what all? Think of everything that is on top. The upper one third of the lateral wall. Then you have the roof of the nasal cavity and the upper one third of the septum. So basically, the roofed arch, the upper one third of the septum, the roof, and the upper one third of the lateral wall. That is where you have the olfactory region. I'll tell you why it's the upper one third. I'll come to that a bit later. Then you have the respiratory region. The respiratory region is nothing but the nasal mucosa, pseudo-stratified ciliated columnar epithelium. That pretty much and almost the entire respiratory tract, all the way up to the alveoli, is pseudo-stratified ciliated columnar epithelium with very very important goblet cells and submucosal glands. The mucoid discharge, any rhinitis etc., you always have that mucoid discharge, right? Why is it there? It's because of these glands. They continuously secrete mucus, mucin, whatever you'd like to call it. So pseudo-stratified ciliated columnar epithelium. So vestibule lined by skin, an olfactory region in the upper part of the nasal cavity for olfaction, and the respiratory region. Then coming to the nerve supply. Nerve supply is fairly simple. So here what's important is you have to remember that you have first, let's look at this for the sense of olfaction. What all do you have for the sense of olfaction? You have, this is the roof of the nasal cavity, right? Cribriform plate. It is pierced, it has openings, it is pierced by the olfactory nerves. It pierces the cribriform plate, and just above the cribriform plate you have the olfactory bulb. Then that goes as the olfactory nerve or the second cranial nerve to the brain. So very very important, if there is any injury to this cribriform plate or to the olfactory nerves itself, imagine if the olfactory nerves get injured, then those holes become open, right? From there CSF can leak into the nasal cavity and nasal discharge can be CSF. So that is known as CSF rhinorrhea. So injury to this region, two-way. Remember, if injury to the olfactory region, then there can be two-way. Number one, CSF can leak into the nasal cavity. Infections can go to the brain. So there's an injury to the cribriform plate. So what happens? CSF will enter the nasal cavity, CSF rhinorrhea. Infections in the nasal cavity will go to the brain. So it is a dangerous condition. Then come to the very very simple. Here you have the lateral wall. Here you have the nasal septum. Lateral wall, nasal septum. Same thing, anterethmoidal nerve, posterior-ethmoidal nerve, anterethmoidal nerve, posterior-ethmoidal nerve. Then you have the infraorbital nerve supplying the vestibular region. Then here you have the branches of sphenopalatine ganglion in the lateral wall, whereas in the nasal septum you have branches of the nasopalatine nerve. All of these are for mixed sensation, that is general sensation, common sensation like heat, touch, irritation, all that basic common sensation. Special sensation, olfaction done, olfactory nerves, then anterethmoidal, posterior-ethmoidal, infraorbital nerve, branches of nasopalatine nerve and sphenopalatine ganglion. Then come to the autonomic nerve supply. Autonomic nerve supply, very very important, because predominantly we have parasympathetic nerve supply, that is secretomotor fibers. They cause secretion of mucus because of vasodilation. Parasympathetic increases secretion because it causes vasodilation, and sympathetic decreases secretion by causing vasoconstriction. So we do something known as Vidian neurectomy or Vidian nerve dissection. What is this Vidian nerve dissection? Basically, when there is excessive rhinorrhea, we dissect the Vidian nerve so that secretomotor nerve supply gets cut off and the mucus secretion significantly reduces. So what is the nerve supply? Piercing the cribriform plate, olfactory nerves for olfaction. Injury can cause meningitis or CSF rhinorrhea, whereas mixed sensation, you have various nerves like infraorbital, anterethmoidal, posterior-ethmoidal, sphenopalatine ganglion, nasal ganglion, etc. For autonomic sensation, sphenopalatine ganglion branches itself, but the sphenopalatine ganglion is supplied by the Vidian nerve, which carries predominantly parasympathetic fibers, but both parasympathetic and sympathetic. And this Vidian neurectomy can help us deal with excessive rhinorrhea by decreasing parasympathetic secretomotor neural discharge, or basically parasympathetic secretomotor function. This is about nerve supply. Then come to lymphatics. Lymphatics, you have submandibular lymph gland and jugular lymph node. Submandibular lymph node, not gland, I'm sorry. Submandibular lymph node and jugular lymph node. Now, one very important thing to remember here is why this is important. Basically, for malignancies like nasal cell carcinoma, they tend to metastasize to lymph nodes. Not that important. So basically, what you should remember here is osteomeatal complexes and the turbinates, the blood supply for the septum, the parts of the septum, and basically the general idea of internal nose. This might be a little bit of a complex lecture. If you have any doubts, please let me know in the comment section. If you enjoyed the video, if you found it helpful, please like, share and subscribe. Thank you for watching.